Good afternoon, everyone. We're going to give another half a minute or so that the people who are going to be joining us maybe a little late, we'll get them to see the entire webinar. Okay, why don't we get started? I'm Dave Duncan, Chairman and CEO of Duncan Financial Group. I first of all want to thank you for being part of our presentation today. We have some really valuable information we'd like to share with you, but we want to make sure that you and your family continue to be safe and do all the things that the CDC and Governor Wolf would like us to do relative to distancing and all those types of things, masks, etc. So please be safe in these very, very unusual times. Today, we're going to talk about group health insurance and HR, human resources issues related to the coronavirus. But I also want to remind everybody that we also do 401ks and other type of retirement plans. We do commercial insurance, and we do tax and accounting services for businesses. So you can rely on us for a wide variety of financial services. I'd also like to give you a quick update regarding the situation at Duncan Financial Group now. As I like to say, we're doing business as unusual in these very turbulent times. We have about 108 employees, 8 to 10 of which are in the office every day practicing social distancing, and the other 95 to 100 are all working remotely. So no matter what your questions are, your needs are, we have our full staff of people ready and able to help you with any insurance, investment, or tax issues. A couple of housekeeping items here. You can ask us questions through the Zoom portal. You know, the presentation is going to last about 30 minutes. And then at the end, we're going to save time for questions. So as the presentation goes on, feel free to type in a question and we'll address that at the end. We're going to send a copy of the slide deck that we have here to everybody that's on the webinar. So you can make some notes, but you'll get the full benefit of these slides when we're done. And we are going to have a replay of this webinar available on our website, duncangrp.com, in a day or two. I just want to emphasize that we're here to help. So with that, I'm going to turn it over to Brad Prentice. Brad runs our group health insurance business, and he's going to begin the presentation. Brad, it's all yours.
Thank you, David. And thank you very much for your time, everybody. As you know, it has been a very trying period, and we've never seen anything like this before. So please stay safe and keep your social distancing. In today's preview, we're going to have Rachel Bodai, myself, and Jennifer Roman of our HR department speak on behalf of what's going on inside employee benefits. Our first presenter will be Rachel Bodai of the Employee Benefits Division. Rachel?
Good afternoon, everyone. So the very first topic we are going to discuss is actually open enrollment by the carriers. So what the carriers are doing is they are allowing a special open enrollment period in terms of your group medical plan offerings. For example, employees with a single medical plan offering can actually buy down to a leaner plan. Of course, there are certain guidelines that would apply per carrier based on the plan that you currently have in place. Carriers such as United Healthcare and UPMC are allowing this to occur through May 31st, 2020. Of course, the intent to adding a plan off of your normal renewal cycle is to introduce a higher deductible, which in turn would lower your premiums during the pandemic. In terms of the coverage as it relates to COVID-19, the first item would be what is being covered in terms of testing. So the core group health carriers that we deal with, which are primarily UPMC, United Healthcare, and Highmark, they have actually chosen to waive all copays, coinsurance, and deductibles as it applies to testing for the COVID-19 virus. In terms of the treatment, what they're doing for the coverage is they originally had not been treating or actually covering the treatment, but now they have changed all their provisions, and they will also waive cost share involved with treatment of the virus. Meaning that, for example, UPMC, they would be waiving all deductibles, co-insurance, and copays for all in-network COVID-19 treatment for members in fully insured plans, Affordable Care Act plans, as well as Medicare Advantage plans. This provision also can apply to self-funded cases should the groups decide that they would like this provision added to their plan. As of now, this policy change and provisions will stay in effect through June 15th, 2020, with UPMC, United Healthcare and Highmark are waiving any cost share through May 31st, 2020. So I'm going to turn it over to Jennifer Roman to discuss strategic planning options and benefits for employers and employees.
Thanks, Rachel. In the next few slides, we are going to talk about a variety of strategies to think about and how each of the strategies are affected by the Families First Coronavirus Response Act and the Coronavirus Aid, Relief, and Economic Security Act. Employers should be aware that the guidelines we are going to go over only encompass what is available to date, and that these guidelines are subject to revisions by the government. So let's get into it. We're going to talk about reduction of work hours, furloughs, layoffs, and temporary business closures. So we'll start with the benefits of reduction of work hours. For businesses still operating with a full staff, either remotely or on site, our recommendations to our clients at this point would be to look at productivity measures. If you do not have measurements in place, there are simple ways to take the data you have to develop a comparison. Once you're clear on how your current productivity compares with your regular volume, you should be able to decide how much of a reduction is necessary to handle the current volume. It's important to be selective when you're looking at reducing hours. Reduction of hours may cause some employees to look elsewhere for work. So excluding high performers from an hours reduction might be the right strategy for your business rather than an across-the-board reduction. Employers will be able to affect real-time payroll costs by reducing hours for payroll. The employees can file a partial unemployment claim. Even with a partial unemployment claim, they are eligible to receive the additional $600 per benefit week until the end of July. For many workers, this will significantly increase their regular income. With regard to regular eligibility for healthcare benefits, employees are required to maintain at least 30 hours per week to be eligible. However, many providers have made temporary changes to their allowances for eligibility based on the current circumstances. I'll hand this over to Brad to discuss specific carriers at this time.
Thanks, Jen. As you know, in the past, each group medical care had a minimum threshold of hours to be considered full-time, as well as the employer set hours to be considered full-time. Currently, due to COVID-19, the core group of health cares, such as UPMC, Highmark, and United Healthcare, are waiving the minimum number of hour requirements. If employers maintain employees' coverage on the plan for those with reduction in work hours, you must continue to pay all monthly premiums for the provisions to be maintained. It is important to note that the coverage must be offered to impacted employees on a uniform, non-discriminatory basis. There are other options. There have been different ways that employers are handling the premium component with possible reduction in work hours, as well as furloughs and layoffs. Some employers who are able to maintain a few employees as active also have chosen to pay for benefits for those not actively at work through the month of April. As for May, we'll have to see how it plays out through the state of Pennsylvania and Governor Wolf. Some employers have done voluntary layoffs in which the employees continue to pay for the contributions to the group medical coverage. Others have just chosen to offer COBRA due to the reduction of work hours, which is considered a qualifying event. Please be advised, in the state of Pennsylvania, there is coverage for COBRA under all group circumstances. For example, many COBRA applies for groups with up to 19 eligible employees, and this would extend to medical coverage only. And it also only applies for 9 months, whereas federal COBRA applies to employers with 20 or more eligibles, and this would extend to medical, dental, and vision, and coverage is up for a standard period of 18 months. I'm now going to turn it back over to Jen to discuss more about furloughs.
Thanks, Brad. So we're hearing a lot of employers and the government talking about furloughs in the wake of the coronavirus. We wanted to go over what exactly a furlough is. In the simplest terms, it's an unpaid leave of absence. A furloughed worker remains an employee of the company and can be called back to work at any time. Companies have the choice of continuing benefits for employees if they choose to do so. However, this is not a requirement. Hourly employees may work sporadically during a furlough. However, they should be compensated for their time in accordance with state and federal wage and hour laws. For exempt employees, it's recommended that a no work rule be instituted. The reason for this is that if an exempt employee works at all during a work week, they are required to be paid for the entire week. Can an employer require employees to use paid time off? This actually varies from state to state in accordance with state laws. So it's best for an employer to offer employees to use their paid time voluntarily during a furlough. This may be a good incentive because people are experiencing delays with unemployment claims. Employees are eligible for unemployment during a furlough, and as mentioned in the previous segment, they would be eligible for the additional $600 per benefit week through the end of July. It's important to note that furloughs are a short-term solution. If it's determined that you cannot return your employees, a furlough can be transitioned to a layoff. The true purpose of a furlough is to allow employers to make quick reductions in payroll to react to temporary conditions in the market. This also allows the employer to quickly return to full capacity when the time is right instead of having to hire new employees. Furloughed employees are required to be returned to their previous position with the same pay. And I should also note that employees can look for other work during a furlough. So keep this risk in mind if you're considering a furlough. Rachel, what can you tell us about benefits during a furlough?
Okay, thank you, Jen. Yes, in terms of benefits for furloughs, it would really apply, as we talked about earlier, in terms of inactive employees being able to maintain their coverage through the group health plan. This can occur either by the employer paying for that coverage, or they can be extended COBRA during a furlough situation. So each carrier is going to allow a different time frame for this provision. So it's important that you check with your carrier or check with your account manager, and we can assist you on how that would apply. So Jennifer, at this point, can you please address layoffs?
Sure. When should an employer consider a layoff? So in contrast to furloughs, with a layoff, employees do not need to be returned to the same position, the same pay, or have any specific time that they need to be returned to work. With a layoff, this will provide an employer a little bit more flexibility in returning employees to work. So this may be worth considering. Employers are not typically permitted to continue benefits after a layoff. Many employers are required, however, to continue benefits under COBRA. Also, a layoff does not need to be designated as permanent or temporary. Therefore, employers laying employees off are not required to provide a return date or return the employees at any specific time. As with the other strategies I've already discussed, employees will be eligible for the additional $600 a week in additional benefits through July. And for those who have a permanent or long-term layoff, the government has added an additional 13 benefit weeks on top of the state allowance for benefit weeks. As the enhancements to unemployment stand right now, employees making $60,000 or less in the state of Pennsylvania will likely make more on a weekly basis through the end of July on unemployment than they would maintaining their regular full-time job with an employer. And Brad, can you talk about benefits in this situation?
Certainly, Jen. With layoffs, obviously you have a choice on how you want to handle the medical continuation. Obviously, with COBRA, as I mentioned earlier, you may or may not pay for coverage, but keep in mind, for inactive employees during these times, you can certainly terminate their coverage and extend COBRA accordingly, which allows the member and any enrolled dependents to elect to extend their coverage while being responsible for the applicable premium. However, if there is a complete shutdown of the business and no one remains active on that coverage, the plan would be terminated and COBRA would not apply since there's no plan actually enforced at the time. The marketplace would be a wise decision for these employers to opt to mention it to their employees to go to. This would allow them to seek coverage and they may be actually eligible for a subsidy under the marketplace situation. We do have a designated team member who can assist with the individual policies if a corporate shutdown does take effect. I'm going to turn it back over to Jen regarding temporary business closures.
Thanks, Brad. Many restaurants, retailers, and other businesses have instituted temporary business closures during mandated shutdowns or restriction periods in various states. There's a variety of options available to employers who are temporarily closed. While some employers are continuing to pay employees, furloughs and layoffs are also options. For small local businesses, it may be worth looking into a temporary closure rather than staying open with limited operations in physical locations. Communication with employees during this time is critical to ensure that they're aware of your intention to return them back to work when your business reopens. If your employees decide not to return, you may experience some servicing issues once the business reopens. As a proactive measure, employers might want to continue to vet candidates during a business closure so that if existing employees do not return, the business can react quickly. If you can even estimate a callback date, it's a good idea to communicate this to your employees to create a more secure feeling. And Rachel, can you talk about the benefits during a temporary business closure?
Sure, Jen. So the question is, what modifications to plan rules would apply for a temporary business closure? So if there is a temporary business closure in which no one remains active and the group plan is technically terminated, the carriers will waive any associated fees for reinstatement within a 30-day period. For example, UPMC is allowing this for the period of March 2020 through July 2020. There also would be flexibility in terms of the employees and waiving their initial waiting periods during a reinstatement. So that is definitely something to keep in mind as well. Brad, can you please address some of the additional policy provisions, carrier provisions as it relates to COVID-19?
Certainly, Rachel, and thank you. We made some very important bullet points here, 6 of them to be exact. And it's very important that employers realize these do and are in effect. For example, carriers are allowing early prescription refills, which lifts the refill limits as well as waiving cost sharing. We do recommend for the refills that the member explain this to the pharmacy, that this is a temporary override and that the carriers are allowing this due to the COVID-19 situation. Number 2, group medical carriers in most cases are waiving cost sharing for telehealth, which includes virtual visits with providers and telehealth services through their specific carrier. This is also a great way for the employee not to have to leave their home. And also, oftentimes a co-payment is either waived or very less expensive. Number 3, many of the life and disability carriers are offering longer than normal grace periods, and some, such as MetLife and Principal, have granted rate holds. Number 4, MetLife will be granting the rate holds for these groups, renewing June 1st through September 1st, and Principal Financial, their time frame is May 1st through August 1st. As a reminder, these provisions and timeframes would be specific to the carrier in which you have coverage through. And finally, please be reminded to utilize the resources that we have provided in prior email blasts, as well as carrier communications to keep updated on plan changes and extensions through your particular carrier you have in force. Dave, Jen, I'm going to turn it over to you regarding the PPP.
So just a final word about the PPP loans. With all the strategies that we've discussed, if you applied for a PPP or a payroll protection program loan, you may want to limit reduction in work hours, furloughs, and layoffs. Any of these strategies can cause your grant to become a loan if you don't understand the guidelines. So if you're unsure of the guidelines, which will dictate whether your PPP funds become a grant or need to be paid back as a loan, you can call our tax and accounting department to determine what the best course of action is for you. And with that, I'll hand it back over to David Duncan.
Thanks, Jen. Appreciate that. I think now would be a good time for us to do the question and answer section. I'm going to turn it over to Deanne Hutchins for her to ask the questions that have come in. Deanne?
Hi. One of the questions we received, I'm going to let Jen answer, is what if your employees refuse to come into work?
Thanks, Deanne. If your employees refuse to come into work and they haven't been sent home or given the opportunity to work remotely or have shown symptoms of COVID-19, you should follow your standard procedure in your handbook. Showing empathy and giving them, an opportunity to explain why they're missing work or why they refuse to come in is an option. But employers should remember any exception that you make for one person, you would be required to make for every person across the board in most cases. So following the procedure that you have in your handbook, barring any of the exceptions for COVID-19, is the right path to follow.
All right, thank you. The next question. If carriers are providing treatment with no employee cost share, how will this affect HSA eligibility? According to the IRS Notice 2020-15, high deductible health plans may cover COVID-19 testing and all subsequent treatments with low or no cost sharing without compromising the ability to contribute to a health savings account. Okay, our next question, this is also going to be answered by Jen. What is the suggested protocol if you have an employee experiencing COVID-19 symptoms?
If you don't have any type of procedure in place right now, and you do have employees working in your physical location, at minimum, you should instruct your employees to let their manager, your HR person, or another authority person in your organization know if they're experiencing any symptoms, or if they've been in contact with someone that has been diagnosed. At that point, employers should send the employee home and require the employee to be tested. They can call their PCP and find out how they can go about getting tested. And once they receive their results, you can have them report back. And then if they've been diagnosed, they would be eligible for the emergency paid leave. If they haven't been diagnosed, you can give them the opportunity to either use paid time, or you as an employer can give them unpaid time or pay them for their time. That's whatever you do, you should be following it with every employee.
All right. Can an employee drop his dependent care coverage since his child's daycare has temporarily closed? Yes, you can temporarily stop the contributions for dependent care, and once the daycare reopens, then that employee can resume his contributions to the dependent care. All right, this is our last and final question. If an employee who is not on the coverage now, due to having coverage through his spouse, are they permitted to put that employee onto the employer's plan because his wife lost the coverage, even though it is not open enrollment? The answer is yes. Loss of coverage would be considered a qualifying event, so they would be able to add him and any dependents that he wishes to cover onto the plan. That is all the questions we have. Oh, I'm sorry, there is one more question that just came in. Must employees wear a mask in an office setting? Jen, do you want to handle that one?
Sure. So as of Monday, employers are required to have employees wear masks within their physical locations. The employers are actually required to provide the masks, and there's been a little delay with supplies, with employers being able to get them. So in the meantime, there's a link on the CDC site that you can send out to your employees with suggestions on how they can make their own mask until you can provide them. And if anybody's interested, we can send out that link.
Right, that is all the question and answers we have.
Thanks, Deanne. That's a lot of information. I guess that you can tell by the depth of this information. Our staff is extremely well qualified. And I think two very, very important areas for a business owner. You do not want to make a mistake about group health benefits and have an employee or a dependent run up a large hospital bill and coverage is in jeopardy. So you need to manage that program right. And with the human resources area, there's so many different ways you can get tripped up and make a mistake that could end up being expensive for you. It's real important to deal with people that know what they're talking about. As you can see, our staff does. I know many of you already on the webinar are already clients of our group health or HR department, but we're certainly happy to help out those who aren't. And remember that we do 401ks, commercial insurance, tax and accounting services. We're here to help you. The DuncanGRP.com website gives you the contact information of not only the presenters on today's program, but the presenters on the similar programs we did about the other subject matters. So I want to thank those of you who are our clients. Thank you very, very much for your business. Those who are not clients of ours yet, what are you waiting for? Give us a call. But thanks everybody for your time. Have a great day.